We will start with the consent agenda. All the following items which concern reports and items of a routine nature normally approved at AHA meetings will be approved by one vote unless any trustee desires to have a separate vote on any or all of these items. The consent agenda consists of the discussion, consideration, and action on the following items. Minutes of the monthly finance meeting on January 21st, 2019. That should have been 2020.
Sorry.
Minutes of the regular trustee meeting on January 21st, 2020. And a check report, January 9th, 2020 through February 8th, 2020.
I'd make a motion to approve the consent agenda.
Second.
We have a motion by Jay Randalls, a second by Bo Hannaford to approve the consent agenda as it was presented. Roll call vote, please.
Gaspard?
Yes.
Hannaford?
Yes.
Randalls?
Yes.
Simon?
Yes.
Brown?
Yes.
Bob?
Yes.
All right, next. Candace.
All right, EHR status report. ISG is on site working on the new data center, replacing all of the servers. That started last week and will take quite some time to get all of that project completed. There's lots of things that they're working on that continue to be issues, but hopefully we're making some progress and headway on that. I attended a board meeting with OHA a couple of weeks ago, also subcommittee meeting on 802, and also spoke to the Republican women about Medicaid expansion. I think that was last week? I think it was. Before the doctor came? Yeah, it was. Anyway, we're supposed to be hosting a meeting, why did I put July? That would be in March. And I'll be speaking regarding 802. I did see, I think Jimmy Durant sent out something regarding Stitt's plan yesterday or today, that his plan is to have it in place and running his plan up in July. So I'm really interested to see him accomplish that, but no, I don't think so either. I'm with you. We've been running an average daily of around 3 to 4. It has slowed down a little bit. Mark Almack, one of Regina's relatively new hires, has gotten his ACLS and PAL instructor card, so that helps us out. And she's got a couple of, one new person hired, whose spouse works at Northwestern. Shalimar Mendoza, does that ring a bell? That's who she's hired.
He's a librarian. Oh, okay, yeah, no, okay.
Upfront collections, down for January to 15th. It says it's due to the computers being down, so I guess we'll see what that is doing. Working on the True Bridge project, still continues to be a challenge because of our connectivity, getting them on our system. Mark was continuing to work on that today. That's why he's not here to give a report tonight. Building their profiles, so hopefully we can get that up going. We're looking at this point at March the 16th for a go-live date. And if you'll remember, True Bridge is the company that's going to manage our revenue cycle process. Physician Clinic, Steve Madrid is now covering Dr. Self's clinic, and that seems to be going well. Dr. Self made a comment before he left that he felt like that was going to be a good deal, that Steve practices a lot like he practices, has a great bedside manner, easy to talk to, so he was very pleased with Steve and how that was going before he left. And the best news of the night, Dr. Gilbreth has accepted the position, and he will be here. July the 13th will be his start date, and we're super excited. He'll be down at the professional building, Dr. Colbert's old office. I think it's Suite K. So we'll be working with the city to get that back in shape. It needs new flooring and paint, and we'll get that going and be ready for him to get here.
So professional building.
Yes. Professional building. Why is somebody told me that the letters are gone from the professional
Because
building?
we're putting a new sign up,
Awesome.
What's it gonna say?
professional building.
I heard it was just gonna say City of Alva.
From my understanding, I think we're gonna try to do something that might be lighted and just look
A
better.
little more
Yeah.
noticeable. Okay.
But I'll ask that.
You guys have
Yeah.
any more questions for me?
And we'll probably do a contract at some point in time here that we'll all need to look over and that type of deal. So be on the lookout for that, and after Doug gets back, we can go over it and make sure there's no holes, and then we'll get that out so everybody can look at that. So, any other questions for Candace? If not, I would entertain a motion.
Move to approve the written report for February 18th.
Second.
We have a motion by Dr. Brown, a second by Jay Randalls, to approve the Shared Medical Center written report for February 18th, 2020. Roll call vote, please.
Hannaford,
Yes.
Randalls,
Yes.
Simon,
Yes.
Brown,
Yes.
Bob. Yes. Gasper.
Yes. Awesome, okay. Next item is CFO's report. Steve?
Okay, well, I'm excited to tell you that this month I actually have financial statements. So if you'll turn over to the tab CFO Board Report, that third page back, there's a little rehash of some statistics from November of 2019. I realize we're about 3 months behind, so this is probably of limited use to you. I'll just hit the high points, but if you have any questions, we can sure go over some more detail. Operating cash balance, about $153,000. 6.3 days of operating expenses, which is kind of scary if you think about it. What that means in theory is that if we quit taking money in, we can pay bills for 6.3 days before we run out of money. And I wouldn't doubt it at all, having been involved in paying accounts payable since I've been here. We go through a lot of money, as everyone knows. We're trying to get that figure up, and actually cash is doing better. Of course, we got that big check sitting out there somewhere. Whenever we get it, that will help with our cash position and also lower our liabilities. So looking forward to that. Accounts receivable went up about $85,000 during the month. We have 88.5 days of operating expenses in our accounts payable balance. So that's excluding the cost related to salaries, benefits, and depreciation. Gross patient revenue, $1,007,000, which was about an $80,000 decrease from the prior month. And it shows the changes in revenue there. Contractual is about 49%. In other words, we don't get about 49% of what we bill as revenue. It's immediately written off as contractuals and also charity care. Wrote off $190,000 to collection agencies. Gave away $46,000 worth of charity care in November. Operating expenses, excluding salaries, benefits, depreciation, $296,000. That was down $62,000 over the prior month. On the other hand, salaries and wages were up about $41,000 over the prior month. showed a operating loss of about $97,000, but we showed a healthy profit this month. Of course, the vast majority of that, if you turn over to the next page, down towards the bottom, in the non-operating revenue section, you'll see contributions of $500,000 from Charles Morton Share Trust. So that made a huge difference for us in November, helped us out a lot with our cash situation. So, as always, we can't do it without them. They're a big help to us. As far as the income statement itself, you know, I hit the highlights. You can see the various categories of expense. Any questions about any of that while we're looking at it? Other expenses is always a large line item, so in the past, we've always broken that down and give you an idea of what those amount to. You'll notice that a purchase services line, about 6 or 7 lines down, that's going to include our agency nurses and other people that we hire that aren't employed, that we hire to perform services. You'll notice it's been really high. We've been trying really hard to get that figure down. In November, it came down considerably. So we can actually save money by hiring people and paying them wages as opposed to what we have to pay for agency. Nothing else really jumps out in a big way. Repairs were real high for October, but that was getting our roof fixed. So that's come back down. Any questions about any of those expenses? Next page is a 2-year comparison. Really not a whole lot of difference between the 2 years until you get down to that bottom line with that $500,000 gift. But other than that, pretty similar from one year to the next. The good thing is going forwards, hopefully revenue will get better. We're doing a lot of things, including critical access that should impact our bottom line, should help with cash flow and increase our revenue considerably. So we'll see how those play out. Accounts receivable, unfortunately, a little bit of a creep there upwards. That's one of those good news, bad news deals. It's always good to have accounts receivable because that's an indication you're doing business. However, if you can't collect that money, that's not good. So we're always trying to bring that figure down through collections.
And a lot of that's due to the coding issues with the computer being down.
Yeah, no, that's true. This is number.
Yeah, this would have been before.
Or it
actually.
was, yeah, it was.
Balance sheet, not a lot of differences between the 2 years. I don't know that there's anything that jumps out on the balance sheet. Any questions you have with any of those line items? You want further explanation? Continues on the second page for the liabilities and fund balances. So pretty similar years. The last section are the graphs that Kevin always provided. I hope you all that aren't really enamored with those graphs, because this may be the last month you see them. It takes a lot of work to get those graphs. I mean, we're talking days at work. So I'm probably not going to go there because it's going to be a challenge for me just to get financials out. So that's kind of where we're at with that. Any questions on any of that or anything else? Next item is approval, disapproval of the purchase of 12 used hospital beds. Christy Mormon could tell this better because she's the one that's actually been more involved in it. But I believe it's a group home, some type of group home over in Bonita and
Right.
northeastern Oklahoma.
Right.
Received a donation from, I'm guessing, a hospital closed or a hospital got new beds and they just gave away their old ones, I don't know.
Home of Hope, where Christie used to work,
Yeah.
was given the donation of this, all this equipment from this facility that closed.
And that included 20 Hillron hospital beds that, if new, would cost $8,000 to $9,000, something like that. They were asking $3,000 for a piece for the beds. They were in very good shape. They're about 10 years old, but obviously had been taken care of and hadn't been abused or neglected. Christie's really trying to get them down. She's been going back and forth with them. Initially, they wanted $3,000 a bed. We were looking at 12 beds, which would be $36,000, and then $1,000 to get them shipped out here. She's gotten them down to $2,800 a bed, but we have to pay the full $2,000 shipping, which saves us about $1,400 over the initial offer. But we're going to ask you to approve or disapprove at that price of $37,000 because nothing's set in stone right now. That's the very most they're going to cost is $37,000. Hopefully, we'll get them for less than that. We're going to get, if we get those 12 beds, we'll bring them into the hospital. We'll take the old hospital beds over to the nursing home, and then do something with the beds that come out of there. They're probably going to be pretty well used up. Might be sold, might have some useful life. If not, maybe sell them for scrap. But we'll have to get rid of those old beds. So that's kind of it in a nutshell. Does anybody have any questions about any of that? I did talk to Kelly Parker about this. Had him put on his other hat with the foundation, asked if he had any ideas about someone out in the community that might be able to help us with this purchase, and he's come up with some ideas. I think he's talking to some people, so we're hopeful maybe we can get one or two or more people involved in contributing and helping us buy these beds for the hospital. It was kind of one of those deals where we weren't really looking for beds, but it's too good a deal to pass up, we felt. It just doesn't
Several of our
come
beds are in
along
the
very
hospital.
often that you
Or
get
broken.
beds that aren't totally worn out and broken and having wiring problems and that sort of thing, so.
Yeah, and I did call Hillron and make sure that they were still making parts for the bed, and that wasn't a problem.
And my assumption is that these are newer than what we have,
Yeah,
or better.
and I think a better
They
quality
came with
bed.
a cable in it, so. Not heavily used.
Okay.
I
They
noticed,
did say they could still service them.
I noticed they have memory foam mattresses on them, and I don't know if that's kind of the industry
That's kind of what
standard,
we
probably is,
Yeah, that's what we have.
so.
Okay. Any questions?
Make a motion to approve the purchase of 12 used 2010 model Hill Room hospital beds, including shipping, for a maximum price of $37,000.
Second.
So we have a motion from Dr. Hannaford, a second from Jay Ramos, to approve the purchase of 12 used 2010 model Hill-Rome hospital beds, including shipping, for a maximum price of $37,000. Roll call vote, please.
Randalls,
Yes.
Simon.
Yes.
Brown,
Yes.
Bob. Yes. Gaspard,
Yes.
Hannaford.
Yes.
All right.
Thank you.
Steve, anything else?
I'll be glad to do the convalescent home and homestead later in meeting if
Okay.
you want to.
All right, very good. All right, thanks. Medical Staff Executive Committee, as you guys know, Dr. Self has been deployed. So we do wish him well and a speedy return. But in the meantime, looks like we've got a few things we need to do from the credentialing committee. First would be to appoint to Allied Staff Steve Madrid, PA.
Make a motion that we appoint Stephen Madrid, PA, to the Allied staff.
Second.
We have a motion by Dr. Brown, a second by Jay Randalls to appoint to Allied Staff Steve Madrid, PA. Roll call vote, please.
Simon?
Yes.
Brown?
Yes.
Bob?
Yes.
Casper?
Yes.
Hanford?
Yes.
Randalls?
Yes.
The next item is the reappointment to Allied Staff Hina Ray, PAC.
Make a motion that we reappoint to Allied staff in the PAC.
Second. Hanford?
We did both at the same time?
They're both the same thing, so you can do.
Yeah, we could.
Okay, and I'll also
Unless
add to
anybody
that-
wants there to be something separate. If not, make a motion.
amend the motion to appoint both Ina Ray and Aaron Page Kirkenberg to Allied staff.
Second.
I have a motion by Dr. Brown, a second by Kim Ball, to reappoint to Allied Staff Hina Ray, PAC, and Aaron Page Krukenberg, PA. Roll call vote, please.
Brown?
Yes.
Bob?
Yes.
Casper?
Yes.
Hanford?
Yes.
Randalls?
Yes.
Simon?
Yes.
All right, cool. As far as Quappy goes, there was no Quappy meeting this month, right? Is there anything that we need?
I mean, there was
Infection control.
an infection control policy, and there was a change to the CDIF policy to include collecting a specimen from a patient with diarrhea within 72 hours of admission.
Actually, Jason, they did have a meeting on January 9th. There's some minutes back here. It was a pretty extensive meeting.
Must not be
I think it went on for like an hour and 20 minutes or something. They dealt with a lot of different policies.
Bobby does not go in where everybody's board, you just, was told not to, tell them that that's
Oh, okay, I have it.
Yes,
You
you
want me to give the report? Holy moly, it's
Yeah,
like 15
It's
pages
gonna go,
long.
yeah, you're gonna spend an hour going through this thing. I read through it earlier, I was trying to think if there's anything. You know, they talked about stroke initiatives, which we know is very important, deal with that a lot.
Everybody's preparing for the DMV survey, which is probably sometime around May. So we're going through all of our documentation to make sure that we're hitting everything that we should be.
It seems like the government and healthcare providers are looking at suicide risk a lot more than maybe they used to in years past. And the Quappy team did a really good job of assessing all that and following the guidelines and making sure our policy was up to date.
I think all of our staff evaluations have been completed, which was one of the things that they wanted us to work on. Our onboarding process, if you'll remember, one of the things that came out of the survey that I sent out last, when was that? Spring? About spring. So the top 4 things that employees wanted to see see was a better onboarding process, improved wages, improved communication, and better recognition for staff. And so those are some of the things we've been working on communication-wise. We do a Monday morning huddle with all the department managers, Steve and I do, which goes well. One thing that we're adding to that, when Mark gets a little bit of time, he's installed on several of the computers. We have the ability to just click, and if we want to recognize someone, it brings up a certificate. Maybe I told you about that earlier, did I? Anyway, we're going to put a little thing on there where they can go to Holders and get a Jack and Jill. And we're going to recognize them, the employees that receive them for that month, will recognize them in that Monday morning huddle. That'll be the first thing we do, is bring them in and talk about them and recognize them. We worked on the wage matrix. Obviously that worked. We got all the staff hired pretty quickly by doing that. So that takes care of recognition. And then what was the other one I said? Communication. Oh, another
Recognition.
onboarding and wages. The other communication thing that's worked well, we all the managers have GroupMe, the GroupMe app. And so when we have something that needs to be communicated, we're able just to send that out and communicate it with everybody all at the same time. So that seems to be working well too. Regina's using that for the nursing staff, and I think Kelly was going to use that over at the nursing home as well. So anyway, that's kind of where we're at on those things.
Okay. In the validation calendar, everything was either compliant or not applicable, correct?
Yes. Yeah, we've been trying to get that, the validation, that's one of the things that DNV looks at is, do you review your contracts? And so that's why we have that continually on here as a validation calendars, and we've been working to try to get updated calendar, or updated contracts into SQSS and archive the ones that we're no longer using.
All right, so back to infection control, we need to approve or disapprove of the update of the C. diff policy to include collecting a specimen within 72 hours of admission.
Make a motion to approve the updating C. diff policy to include collecting a specimen within 72 hours of admission.
Second.
Is that Simon?
Yes.
Dr. Simon. We have a motion by Dr. Hannaford, a second by Dr. Simon, to approve the update of the C. diff policy to include collecting a specimen within 72 hours of admission. Roll call vote, please.
Bob,
Yes.
Casper,
Yes.
Hannaford,
Yes.
Brambles,
Yes.
Simon.
Yes.
Brown.
Yes.
All right. So next, we'll skip on down to improvement to patient care. I guess I already did the contract review. I always put those two kind of together. Does anybody have any questions on those contracts? If not, the next item is the approval or disapproval of changing to a Santa Claus bleach germicidal wipes. I feel like we do this like,
You missed B, let's go back to B.
that's where I'm at.
You said Santa Claus wipes.
Mine's a G.
That's B.
No, mine's different. My B is about the disapproval of outsourcing vancomycin and pneumonia.
Let's see, it's
That's a C on mine.
Oh, well, I'm not crazy.
No, mine's that way too.
How did that happen?
Hold on,
I don't
look at
know.
me.
No, we're here.
It's. This is.
Yeah, yours is different.
Okay, well, go ahead and do your meeting. I'm sorry. Chief.
All right, so anything I do feel like we talk about this
We do, so.
wipes.
We changed
We
lives a
had
lot.
these huge, we're not we added some new ones. We had these huge Clorox wipes that were like literally this big. And it was a waste because you just need to wipe, you know, down a counter or whatever. Those things are great for beds and bigger spaces. So we got some ones that are a lot smaller and cheaper to use just as a task wipe daily, you know, in between things. So there you go. That's why. We're saving money.
That's always a good thing. So anyhow, when do you approve that?
I make a motion that we approve of changing the two Santa Claus bleach germicidal wipes.
Second.
We have a motion by Jay Randalls, a second by Dr. Simon. To change to the Santa Claus bleach germicidal wipes. It was close. Roll call vote, please.
Gasper,
Yes.
Hannaford,
Yes.
Randalls,
Yes.
Simon. Yes. Graham,
Yes.
Bob. Yes.
It'll be nice, I'm going home. C is the approval or disapproval of outsourcing
Bank of America.
that one, ammonia and the direct LDL testing.
It's to save money.
What is it?
I make a
To
motion,
save
we
money.
approve that,
Okay.
yes.
Vancomycin, so when you give vancomycin, you're supposed to do trough
Right.
lab work, and it's expensive, like we throw hundreds of dollars away per month because you have to get it in a set of, I forget, 6 or so, and so if you don't have any vancomycin troughs that month, you just have to throw it in the trash, because you have to do that. So, don't be surprised if we have to bring it back. I think we'll have to bring it back, but we're gonna try without it, because we'll see.
Savings of about $2,500.
A year, yeah. So we'll see if it works.
Any other questions? All right. I'd entertain a motion.
I move that we approve the outsourcing of vancomycin, ammonia, and direct LDL testing.
Second.
We have a motion by Dr. Brown, a second by Jay Randalls to approve the outsourcing of vancomycin, ammonia, and direct LDL testing. Roll call vote, please.
Hannaford,
Yes.
Randalls,
Yes.
Simon.
Yes.
Graham,
Yes.
Bob.
Yes.
Gasper.
Yes. The next item is the ISTAT replacement plan and the EPOC blood gas analyzer will replace the ISTAT.
So this is a lab issue. ISTAT lost their FDA approval for their cartridge, and so this is the fix for that.
Make a motion to approve the ISTAT replacement plan.
Second.
Who was the second? Sorry.
Dr. Simon.
I have a motion by Dr. Hannaford, a second by Dr. Simon for the approval of the ISTAT replacement plan. Roll call vote, please.
Randalls,
Yes.
Simon. Yes. Graham,
Yes.
Bob.
Yes.
Gasper,
Yes.
Hannaford.
Yes.
All right. So next is the Sheriff Complex.
It was from that med staff that we just approved several things on. It was one of their proposals that was left off the
It's,
agenda.
The hemoglobin A1C.
Next page.
Right back.
That didn't make it out of that.
Currently, we're sending them out. We would like to bring them back in-house. I don't know that we have to vote on that, would we?
on
not
the
on
agenda.
the
Right.
agenda.
Well, I mean, is that something we need to put on the agenda?
No, just voted to
Is it a well,
House,
it all-
especially and outsource it, shouldn't they also?
Is it a policy?
Bring it back.
Put it on for next time. It's the it's the last page, the hemoglobin A1C.
No, I honestly don't even remember
I
talking
remember
about that in
talking about
that
that.
staff. Do you?
No?
I don't either. You think it just got picked up?
We'll bring it back next time. I'll talk to Coco about it.
All right, convalescent home report.
Kelly's not here tonight.
You want me to go with this? I'll be glad to. Operating cash, about 2.5 days of operating expenses, excluding depreciation. Accounts receivable, up about $52,000 during the month. Accounts payable, 26 days of operating expenses. Slight decrease in patient revenue, I believe since then. Hopefully we have some new residents, don't we?
I'm not sure.
Yeah, I'm not really sure.
Last time I talked to him, we were at 48, was where he wanted to stay.
I can tell you that I've been talking with Kelly over the last couple of months about collections, how we collect from people. It's a difficult situation at the nursing home in that someone gets in there, if they're not paying us, it's sometimes kind of hard to deal with. We don't want to kick somebody out in the snow. We have to find some place for those people to go. So, it's a balancing act. How many of those people do you keep around that aren't paying, and how many do you move on to another facility? We don't have a lot of those, but they tend to be high dollar when we do have one, because sometimes they go on for quite some time. So Kelly's really making an effort to get with attorney and figure out how we can get these people back where they should be as far as paying for their living expenses over there. And hopefully that'll help a lot with cash and collections and treat everybody the same way, hopefully. I don't know, we had an increase, fairly substantial increase in wages over there, and again, that's mainly because we're not hiring as many people or not paying as many people to work over there through agency at a much higher rate than what an employee gets paid. So, much better situation, not only for the nursing home, but we're employing people locally, so that's a good thing. Net operating loss of about $27,000 for November. I can tell you, since then, we have gotten a daily rate increase from Medicaid that's significant. That's gonna help our cash flow going forwards. Like I said, Kelly's really getting after the collections and making sure we're current with everybody. So things are looking better at the nursing home. It's actually been a moneymaker for us lately, so it's always good to have one moneymaker when the other one's losing money. And it seems like they tend to flop back and forth, so as long as we can keep paying the bills. That's all I've got, unless you have any questions about anything.
Kelly's done a phenomenal job.
He has, he
He had
really
his work
has.
cut out for him going into that. That's a huge undertaking, and he's really done a good job.
And not only is he working at his job full-time, he's also been studying and taking tests to get his license to work as an administrator over there. So he's really been doing double duty. It's, from everybody I've talked to, really difficult thing to get. I think he's passed the state part and has the federal test yet to take, and then he'll be certified to work in that position.
All right. Homestead report?
I'll read you what Christie left me. She was not able to be here tonight, but you've got your written report. She has 2 that are already paying rent for March, and they will move in April. And she has 2 more that are planning to move in. And Helen Weissel will celebrate her 103rd birthday on the 27th. Faith Hospice was gonna have a party for her this afternoon. And from what I've noticed, they've been going over there, doing activities with the residents over there, which is great. We appreciate that.
Okay. Any questions for anybody in regards to that? Not? Bridget, St. Anthony's report.
Well, I wanted to say that I apologize that I have not been able to be here. I got pulled and had to do an interim CEO job at Weatherford, so I'm happy to say that is over. Have a lot of respect for these guys and gals that are doing this job, because if I had my choice, that's not what I wanted. So, it was, I got to be there during the holidays, so it wasn't a horrible event, so I got to, judge some costume parties, and participated, potlucks, and so it wasn't all bad, but, it's certainly not my preference. So I'm glad to be back, kind of doing what I'm doing. We certainly are moving forward with several of our management agreements, so there is gonna be times when we're kind of situated until we can kind of find our new course, I guess, is the best terminology. So, I didn't bring anything to report out this time, but I was thinking about it on the way down. I don't know what really information that you would like to have from me, and so I just kind of want to open that up and say, is there anything in particular that you would like for me to report out while I'm here? Something you can think about and let Candace know, and I'll be happy to, something that might be, that you think is valuable. So, I know we've been working on telemedicine, which that's been good. We talked about that probably the last time that I was here, that we were anxious to get that all rolled out. So that is, we haven't worked out all the kinks in it, but as far as participation from the specialist level, we've been very happy because they are definitely interested. We continue to have specialty lines come and ask us about interest in telemedicine. So we hope once we kind of get all the kind of little kinks out of it, that we'll continue to get more interest and we'll be more fluid in our process with it. But right now we have endocrinology, pulmonology, pain medicine. We have somebody. I forget them.
We had our first
ENT.
endocrinology Friday,
Okay, great,
telemedicine clinic.
great. And we have cardiology lined up to go. Right now it's just cardiology EP, which would more or less be follow-up visits. Pain medicine is the same thing. Those are more or less follow-up visits. It's not medication management. But endocrinology and pulmonology, they're able to offer quite a few services via telemedicine. So we're looking at bringing our new sleep lab doctor on with us as well too, just to have those extra consults as well. They're pulmonologists as well, and several of them kind of specialize in sleep medicine, so that would be nice. Trying to think who else was like that. That's kind of primarily been Sam's vision. I'm trying to get myself reacclimated even back to those sides of the job too. But we have been extremely pleased about that. So I was trying to think if there's anything.
Dermatology?
Dermatology is a tough one. We had dermatology before, Candace is aware of that. We struggled a little bit with them, so we're hoping that there'll be one that once we kind of get the little kinks out of it and it's more fluid, that we can approach them again to sign back up. So right now we do not have it, but it is definitely really close to number one on the list of requests.
Because I remember when it was first trying to be rolled out, they were talking about that HD camera was
Easier to see.
easier to see than if you were in person.
It is.
It was the logistics of the coordinating
The pictures, they want pictures sent, and we just didn't have the technology behind that at the time to do it. The cameras were not near as good, and you couldn't capture the pictures in any form. We can now. We absolutely can now. So we've just got to find that right time. I'm afraid if we pull them in right now, because we do have a few little kinks here and there, that they might say, well, why'd you ask me to do this again, kind of a deal. But I feel like eventually, we will very much be able to kind of approach them with a fluid platform and try to encourage them to participate.
What do you
See,
do?
yeah,
Good timing.
Yeah. We'll make your own report.
Gotta go.
We should let him first,
Okay.
But thank you for having me back. Hopefully I'll have a more stable life for a while. I was glad to get back on the road today. It was a nice sunny day too, so that was great.
All right, any other questions for Bridget? If not, Bridget, thank you. Again, Bo has left. We won't have a city council report. I don't have any other business to report as well. I think you would keep Rick and his family in your prayers, and also going to ask you to keep Candace and her family in your prayers as well. It's her mother's funeral is this Friday, so. Yes,
Next meeting?
Oh, yes, we need
Yes.
to talk about that.
we do, because
Hang on just a second.
You're gonna be gone for a minute?
I just can't tell them for sure yet, and there's several that are for sure gonna be gone.
so it's the 17th,
I don't think they can go to Arizona.
yeah. So not having Dr. South plus Kim and I both will be gone, that's 3, so that means there's only 4 folks.
And I can't guarantee, I told them I can't guarantee you quite yet.
If you don't,
But I said you
I
didn't
don't
think you
care,
would be
it's
able to
fine,
do
but
it.
if you don't do it before the 17th, I won't be back until the 1st of April. Longest vacation ever. I know, right? Already.
So, I don't need to add any other pressure to Steve, though, to have.
I vote for the 24th.
Or even the 31st.
Or even the 31st,
Hold on.
or sometime in August. I'm struggling, guys. I tell you, this has been a real stretch for me, which is good. We all need challenges in our life, but having never had anything to do with healthcare accounting, and it's just wow.
We appreciate you taking it on.
Yes,
Well,
we do.
it's-
Yes, we do.
It's been interesting, to say the least.
Well, how about we do this? Let's say we're not doing it the 17th. if we don't know that we can even have a quorum for sure. But what do we want? Do we want to just say the 24th? And Candace, we just do it without you, or do we say no meeting and we go to April?
Are you concerned about us meeting without you?
No, you've done it before. No, that's fine. Absolutely all right with me.
That work?
24th?
Mm-hmm. Everybody good with that? Okay. So let's do that. We're adjourned.